Have you heard about intermittent fasting and wondered, is this safe for me if I have type 2 diabetes? Or maybe you're curious if it could actually help your blood sugar levels. Well, today we're breaking it all down, the myths, the facts, and everything in between about diabetes and intermittent fasting. So stick around because what you learn here might be just change how you think about managing your health. Intermittent fasting has been making waves as a trendy approach to weight loss and health management. But is it really a good idea for those with type 2 diabetes? This is a very common question I get from my patients. Hi, I'm Dr. Adelita Hamis. I'm a licensed physician and lifestyle wellness advocate. Welcome back to my channel. Here, we simplify health and wellness topics to help you live your best life. So let's explore the benefits, the risk, and how you can make the right decision for yourself, for your health, especially when you're a diabetic too. Let me ask you, have you tried intermittent fasting before? Or are you thinking about giving it a shot? Drop your experiences or concerns in the comments. I'd love to hear your thoughts. So first is, what is intermittent fasting? Let's get on the same page, shall we? Intermittent fasting. So what is it? Intermittent fasting is not a diet. Let's be clear about that. It's not a diet. It's an eating pattern. It involves cycles of eating and fasting with popular methods like 16:8 or 16:8. 16 hours of fasting, 8 hours of eating. There's also 5-2, 5 days of normal eating, 2 days of low calorie intake. Some people also do alternate day fasting. And there are a lot of modifications now for intermittent fasting. So be sure you understand that. There are a lot of science coming up now behind intermittent fasting and diabetes. But let's understand the basics here, okay? How it may help type 2 diabetes. We know that type 2 diabetes is caused by insulin resistance. But intermittent fasting has shown that it can improve insulin sensitivity. Think of insulin as a key that helps sugar enter your cells. When you fast, your body becomes more efficient at using that key. How's that sound? Simple, right? So now the intermittent fasting supports or enhance insulin sensitivity instead of resistance. And another cool thing about intermittent fasting is it supports weight loss. Excess weight is a major driver of insulin resistance, and intermittent fasting can help shed those extra pounds. If you shed those extra pounds, your insulin resistance decreases. Another cool thing about intermittent fasting is it stabilizes blood sugar. Fasting periods may reduce blood sugar spikes, keeping your levels more stable throughout the day. But there are risks also that you need to know when you're doing intermittent fasting. First in our list is hypoglycemia. If you're on medications like insulin or sulfonylureas, like glipizide, fasting can lower your blood sugar too much. Drastic or dangerous low blood sugar levels can result to that when you are doing this style of eating along with medications for diabetes. So it can drastically or dangerously drop your sugar. Another risk for intermittent fasting is nutritional gaps. When you skip meals, so skipping meals can sometimes lead to poor food choices when you break your fast. Some people cannot hold the hunger too long, and when they do, they end up with making poor dietary choices when they eat. That's a big risk. Another risk is it's not a one size fits all. Fasting isn't ideal for everyone, especially if you have a history of eating disorders or other medical conditions like hyperacidity. I have a real life example here for you, and I'm not sure if you can relate, but let's say you're someone who skips breakfast and calls it fasting, but then struggles with low energy or sugar cravings by noon. Sound familiar? Did have a patient like that. And this is where a well structured fasting plan, not skipping meals randomly, can make all the difference. So when you say I'm on intermittent fasting, make sure you're talking about it's a structured eating plan. It's not a skipping of meals. All right? So here's my tips for intermittent fasting with type 2 diabetes. Number one, you should not forget this or skip this. Talk to your doctor first. Why? Because you have diabetes, and especially if you're on medication. Always, always consult your healthcare provider before starting intermittent fasting, especially if you're on medication. That's very, very important, and you should not skip that tip. Number two, please start slow. Start slow. Try a 12-hour fast initially to see how your body responds. So that means within 12 hours, you can eat, and then the next 12 hours fasting, typically at bedtime. Number three, my third tip, focus on nutrient dense foods. Break your fast with high fiber, low fat foods like leafy greens, whole grains, and plant based proteins. And then, my fourth tip, you stay hydrated while you're on intermittent fasting. You gotta stay hydrated. Drink plenty of water or herbal teas during fasting periods. Just because you're fasting doesn't mean you can't drink. You might throw yourself to dehydration or electrolyte imbalance. Fifth tip, monitor your blood sugar. Make sure you check your levels before, during, and after fasting to ensure they stay within the safe range. Do not forget you're on medication, especially when you're on medications. You gotta be checking your blood sugar. Have you ever wondered if a lifestyle change like intermittent fasting could make managing your type 2 diabetes easier? Let me know your thoughts. I'm curious. Or questions in the comments below, okay? So, we have to remember intermittent fasting can be a powerful tool for managing type 2 diabetes alongside with healthy eating, exercise, stress management. Throw in the intermittent fasting, that can be a powerful tool to help manage your diabetes. But it's not a one size fits all solution, okay? By understanding your body's unique needs and working closely with your doctor, that's very important, you can make the right choices for your health. And make sure you're doing this safe. That's what your doctor needs to know. Well, friends, if you found this video helpful, please like, subscribe, and share it with someone who might benefit from this information. Remember, your health journey is personal, and I'm here to guide you every step of the way. That's all for now. Thank you for watching, and I'll see you next week. Bye!